Dear friends, my name is Dr. Igor and I'm clinical oncologist practicing since 2010. Today we are talking about the next vitamin. It's fat-soluble vitamin, meaning its absorption depends on the work of your gastrointestinal tract, specifically the organs that are needed to absorb the fats, like pancreas, like liver, bile and gut. And people who have problems with these organs, they may have a deficit in fats, in absorption of fat-soluble vitamins like A, D, E and K. Vitamin E is tocopherol or alpha-tocopherol, and it's considered to be a potent antioxidant, meaning it will neutralize free radicals. What are the symptoms of its deficiency? To be honest, no symptoms are really described. The only thing, there is a very rare genetic condition, genetic disease, when vitamin E is lost from the body in high amounts. That means these people will develop a deficiency in vitamin E. And their main symptom is ataxia, loss of coordination, and they will have problems with their cerebellum. And if they get supplements of vitamin E, everything is okay afterwards. In mice, vitamin E showed that it's really needed for their reproductive function, but in humans, it was not proved, and this effect was not seen. Also, vitamin E regulates the work of our genes, and it can suppress the enzyme protein kinase C. Due to this action, it is considered that vitamin E can decrease the inflammation, especially low-grade chronic inflammation, like for example in atherosclerosis and obesity. It can also decrease the function of thrombocytes, meaning it's against blood clotting, and it's considered that it can protect from vascular complications of diabetes mellitus. Deficiency in humans may lead to somewhat increased risk of premature babies and increased rate of atherosclerosis, accelerated atherosclerosis. Unfortunately, when it was checked by, these are associations, but when it was checked in real patients in clinical trials, unfortunately the supplementation of vitamin E didn't show any effect in diabetics, in atherosclerosis, except in one clinical trial. It's called, abbreviation is CHAOS, and it showed some benefit, but all the others didn't show any benefit. That's why it's not recommended currently, neither for atherosclerosis or its complications, neither for diabetes. What else? They also tried to do different clinical trials for patients with different conditions. For example, with age-related cataract, no effect. To prevent cancer, no effect. By the way, even a little bit increased risk of prostatic cancer. Also in prevention of dementia, no effect, and in treatment of Alzheimer's disease, no effect also. But actually it can have some effect in elderly, because there was the investigation made done in Colossus in 1990. They took the elderly patients, and some got placebo, some got supplements of vitamin E. It was 800 milligrams per day for 30 days. And they showed benefit in their work of immune cells, and they made a conclusion that it can help those people to improve their defense from respiratory infection for elderly. Before, by the way, I was talking about zinc for those patients, because elderly often have zinc deficiency. And also omega-3 and pre and probiotics. And also vitamin E sometimes can be used for treatment in the complex for treatment of non-alcoholic fatty liver disease. By the way, the main treatment for that disease is low-carb diet and hepatoprotectors. Dear friends, now you see that vitamin E supplementation is rarely needed, with some exclusions. Mostly you can get vitamin E in good amounts from food like nuts, bananas, wheat germ, avocado, peppers, salmon, sunflower seeds, etc. And this is all for today. I see you in the next video. about vitamins or about other topics. Wish you good luck and good health. Bye bye.